It's reached a crisis point. The North Bay Children's Aid Society says the number of babies born to mothers with addictions has doubled over the past 2 years. As CTV's Linda Holmes tells us, the society is working with community partners to reduce those numbers.
The Children's Aid Society of Nipissing Parry Sound noticed an alarming increase in children being admitted to care, specifically infants. As the trend continued to rise, the agency reached out to community leaders and discovered just how widespread an issue it is.
We had exhausted all foster homes in Nipissing Parry Sound, and we were actually going out of community, so placing these infants 2 and 3 hours away. And transporting these kids in and out of for access visits. And got to a crisis point where we actually had to rent a cottage and staff it to be able to meet this increasing demand.
A baby born with neonatal abstinence syndrome can experience withdrawal symptoms, irritability, high-pitched crying, even seizures, depending on what the addicted mom was taking, both prescription and non-prescription. In North Bay, the average hospital stay for these babies is 13 to 20 days.
Probably about half of our mums are taking treatment medications that are helping with those addictions, and they're in programs and getting the support that they need. And the babies do have to go through these symptoms, but absolutely these are mums that are doing their best to treat their addictions.
The number of cases in North Bay has more than doubled in the past 2 years, from 22 to 43. There were 10 cases last January alone. A forum entitled Addressing Addiction Together looked for solutions.
We looked at pregnant mums using, and we looked at parenting mothers, as well as we know that the key to success and affecting change is really prevention. So we wanted to also look at at-risk youth and developing pathways to begin to work more effectively with these young women.
Support is often provided through counseling to improve a pregnant or a new mother's ability to bring the baby home and raise her child well.
Community Counseling Center of Nipissing has a full-time worker who works with the women with opiate addictions if they're pregnant or parenting. And so that, for example, that woman would be surrounded by whatever resources in our community that she would need.
Northeastern Ontario is rated second highest in Ontario in terms of babies born with this syndrome. Linda Holmes, CTV News, North Bay.